Hi, everyone. Hi, everyone. How many developers in the room? Good. How many physicians or scientists? Not many. How many entrepreneurs? Very few. Okay. So you are in a minority, guys. Okay, good. So let's just start. Okay. A little bit about myself. I have a dual affiliation. I'm the director of e-health at Hospital San Joan de Déu, which is the largest children's hospital in Spain. And what I do there in the innovation department, I run a project called the Liquid Hospital, which is about using technologies to provide services and content to patients and families. Okay. So my role here mainly is listening to physicians and nurses and trying to do what they want to do. Okay. And then my another position is as director of academics at Moebio. Moebio is an accelerator where, as Sebastian said, we put entrepreneurs, we put teams of people, multidisciplinary people, into hospitals, inside hospitals. Okay. So the key message of my speech today is that it is better to observe physicians than to listening to them. Okay. And I'm going to prove that to you. Okay, 3 things. I'm going to explain a little bit where all these come from. I'm going to explain the program, which we call Design Health Barcelona, or D-Health, and then some of the outcomes after 2 years of experience. Okay, sounds good? Okay, good. So, fostering entrepreneurship. Okay, this is Catalonia. Catalonia is a 7 million region in Spain. You know, you can see we have more than 500 companies in the life sciences arena. 17 university hospitals only there. How many university hospitals does Germany have? I think it is 24. We have 17 already there. Science, technology parks. So a great ecosystem. Okay, and not only infrastructures but also people. You know, the main thing that Catalonia and Barcelona has is not the football club, but is the physicians and the nurses and the scientists. Okay. So let me explain 2 of the programs that we have there to foster entrepreneurship. Number 1 is something called Bioemprendedor 21, okay? And what we have here, this is a program for people who already have ideas to make them into companies, okay? We've been running this for 7 years already, and I'm going to be showing you some of the numbers, okay? But then we realized something, you know, that there were lots of people who wanted to enter healthcare and didn't know how to do it. Okay, basically, John Doerr, one of the most experienced PCs in the U.S., says that every smart person that he knows is entering healthcare. Okay, and what we want is getting all these smart people trying to enter healthcare. So we created this thing called D-Health Barcelona, or Design Health Barcelona, which is a multidisciplinary program based on the Stanford Biodesign Initiative, which has been running for 15 years in the Valley, okay? And 2 years ago, we put it into place in Barcelona. So I'm going to cover a little bit about this and a little bit about this, okay? So let's start with the Bioemprendedor 21. In these 7 years, 61 companies have been created. They've raised 54 million euros in capital, and they have created almost 300 jobs, only in life sciences, okay? The most important thing is that half of these companies are already producing products and services in the markets, okay? So they are not pre-companies, they are companies who are producing services and products. And these are some of the companies. For example, here you can see one which has been the number 3 company in terms of getting money from VCs last year, okay? So they are very interesting companies. Problem with us is that we have people who are from the healthcare system already, okay? And we want to get smart people from outside of the healthcare system. So that's the reason why we created D-Health Barcelona. And D-Health Barcelona is a 9-month program which basically tries to solve this problem, okay? My role at the hospital is get people who have, you know, technologies. You know, every other week I get somebody from a technology center or from a university coming to me and say, hey, I have invented this great technology. Can we use it at the hospital? Okay? This is a lot of very similar to the approach that developers do, right? You know, I have invented this app, and you know, how can I use it at the hospital? Okay, but this is not the right approach, because in the end that doesn't work. People at Stanford realized that companies were failing not because the product was failing, not because the technology was failing, but because the market was failing, the need was failing. The product worked well, but it didn't serve any need, okay? So they created this program called the Stanford by Design, which we have brought to Barcelona. The startup world is a risky business. 70% of the companies fail, and 25% fail in the first 12 months. Okay, so a process and a methodology is very important for that. And the most important thing is that these failures are very costly in healthcare. Okay, they cost a lot of money and a lot of time of very smart people. So the important thing about the program, and this is the insight that people from Stanford realized, that we were spending lots of money and time in implementing projects, but we were not spending enough time identifying the right products. Okay, and the way to identify the right products is not listening to physicians, is not listening to technology centers, is not listening to universities, although Stanford is a university. It is entering the place where the needs are, where there are unmet clinical needs, and this is hospitals, okay? So we have created a program called Design Health Barcelona, which is a mix of the biodesign program from Stanford, the lean startup methodology, and the creative leadership tools from Chaos Pilot in Denmark, okay? So let me explain a little bit about that. I think it's a very powerful program that you can bring to here as well. So basically, the program has 3 phases. Nothing very smart, you know, but everything starts with identifying the right unmet clinical needs, okay, things that are not solved already. The second phase is you have to invent a technology that solves that need. Traditionally, it is more mixing existing technologies, creating a new product to solve that need. And then the third phase is creating a company that, you know, sells the product so we can solve the need, okay? The usual way we do things in healthcare is we invent technologies and then we try to find a problem to focus, okay? But we have to do it the other way around, okay? And then apart from that, you start with a boot camp, which is a 5-week time where all the entrepreneurs learn the different languages. You know, it is one of the most funny conversations I've heard is between a businessman and a physician, or between the physician and the engineer, because they don't understand each other. Okay, they both speak Spanish or Catalan, but they don't understand each other because they don't have the right language. Okay. And then the program goes with this process as well. There is an academic program going with the process. Okay? The most interesting thing about is this. This is the first phase, and we get teams of 4 people, 1 business people, 1 designer, 1 engineer, and 1 physician or scientist into hospitals for 2 months, for 8 weeks, and they have the goal to identify more than 300 unmet clinical needs. Okay. It's not just the process, but the people at Stanford have created this book where there is all this information about. This is a huge book with more than 800 pages with all the 3 phases, you know, very detailed into sub-phases and everything inside. Okay. So let me explain to you a little bit more graphically how it works. You know, here we get the teams into the hospitals. They have the goal of identifying. We have 3 hospitals at the moment running the program. We get the 4 people teams into the hospitals. They have the goal to identify more than 300 unmet clinical needs. Okay, then through a process of filtering, they end up. We move from 300 to 100 needs, then from 100 need to 50, then from 50 to 30, from 30 to 12, from 12 to 4, and then with these last 4, you know, what we do is again we diverge. Okay, so through creativity techniques, you know, these guys, they create concepts to these needs. Basically, in terms of innovation, what we call here need concept is what we call here problem solution. Okay, so these guys, they end up selecting a project that is the right mix between this and that. Okay, very simple but very powerful. The powerful is that you start with a lot of people, and the good thing is that you discard some of these problems only because you already know that they are not going to be good projects, okay? That's very, very powerful. Okay, so what is different about the program? The first thing is that traditionally in entrepreneurship, if you do a master's program, what they teach you is subjects. Okay, they teach you finance for entrepreneurs, marketing for entrepreneurs, management for entrepreneurs, okay? Here what we teach is a process, the process of innovation. Biodesign is a methodology on healthcare innovation, okay? Identify, invent, and implement, number one. Number two, disruption is how we do it. You know, traditionally, the way we've been teaching people in the last 100 years is through seminars, like we're doing now, okay? I'm talking and you're listening, you know? More and more, we're flipping the classroom, okay? So we get students learning through videos, and then what they do is they get on stage and they share what they're learning outside. The third place is, the third disruption is who is this targeted to? Almost all the programs that you have in healthcare and in other areas, they are about you, okay? They tell that you work in groups, you work in groups, but you really don't work as a team. Here, everything you do is as a team, okay? So you have life sciences, a designer, an engineer, and a business person in each of the teams. And what they do, you know, no matter how much money or how much time we give them, only one of them could be able to solve the problem. So they really need each other to find a solution to the problem. And then the last disruption is where we're doing it. You know, traditionally, if you go to a master's program, what you get is they teach you about one business case that was successful or unsuccessful in the past. For example, you try to understand how Coca-Cola entered the Cuban market in 2015, okay? And you know, through using this technique, they aim that you learn the skills needed to be an entrepreneur, right? Reality is that here in the program, you work on your project, okay? It's not us telling you what are you going to do, it is you selecting your project, it is you doing everything. So it's your project, it's not somebody else's project. So these are the 4 disruptions in terms of an educational model, okay? These are the 3 teams we got last year, mostly men you see here. These are the 2 teams that we have last year, in this case almost women, almost no guys involved, okay? There are some very interesting videos that I'm not going to put now because I want to show you this, but in the web page in moevio.org, we have 1 video for each of the phases, okay? And it's very, very interesting because it explains everything. You get a real sense on what it is. So let me share a little bit of the outcomes because I think this is very interesting. So we have 3 different hospitals. This is Clinic Hospital, one of the top 3 hospitals in Europe. San Juan de Deu Children's Hospital, one of the top 5 children's hospitals in Europe. And this is Institut Guttmann, one of the top 2 rehabilitation centers in Europe. These are the numbers that the teams identified last year, okay? These are the number of needs. As you can see, you know, people, when I say they need to identify more than 300 unmet clinical needs, people are scared, like, that's too much, okay? Reality is that there are so many opportunities inside hospitals, okay? The more needs identified doesn't mean that the hospital is worse. It only means that the teams are digging deeper, okay? And then apart from that, in the 3rd phase, in the implementation phase, we don't end up with a business plan. What we do is we follow the methodology by Osterwalder and Steve Blank about the Lean Launchpad. And these guys leave the program with between 100 and 200 interviews with potential clients, okay? So they have clearly targeted their product market fit, okay? So these are the results from last year, and the results from this year are very, very similar. Very interesting, and this is what is the most important thing about the program. This is a program that is ecosystemic, okay? It's not only good for the entrepreneurs, it is good for all the actors, all the agents in the healthcare system. The first thing is that out of these 1,400 identified unmet clinical needs, around 15% of them are what we call improvement report. They are things that are not business needs, but they are very good for the hospitals, okay? So the teams, they create something like a consulting report that they give to the hospital, so the hospital can implement, you know, new, let's say new processes, new communication tools, etc., to improve their performance. There is another 25% of these needs. They are what we call scientific discovery needs. That means that they are things that need a discovery from the science or advance from technology to make it a good business opportunity, okay? And we give this to research centers, universities, research centers at hospitals as well, okay? Because these are very interesting topics for, sorry, Horizon 2020, Horizon 2020 research grants, national grants, or regional grants, okay? Master theses, postgraduate theses, etc. So it's a great way of doing for people to study on things that are really a clear need. Because sometimes when you talk to researchers, especially in science, when you ask them, why are you studying this topic, okay? They say, they hardly say because it's important. They usually say because I like it, okay? So we have to find ways where you like things, but they're also important for society. Then there are other 20% which are improvements to existing medtech companies. Okay, for example, we get Sanofi as one of our corporate partners, and Sanofi gets improvements for their glucometers when we're doing these things in diabetes. Okay, and then the rest, you know, these 40% are what we call potential business needs. Okay, let me show you 3 examples so you get an idea on what it is, right? This is from Stanford Biodesign in Silicon Valley. The team was in the cardiology department. They realized that the Holter, you know what a Holter is? Anyone has ever wear a Holter? No? Okay, this is one of these things that has many patches that they stitch around your body, and it's difficult when you take a shower because when you walk around, it's very uncomfortable, okay? So these guys, they said, hey, why don't we try to make this smarter, okay? Why don't we do something with this, and we try to improve this, because there are new technologies available. So they created the iRhythm. Basically, it is a patch that you attach to yourself, just only one, okay? And then this thing reads everything, and then they send it to a cloud, and then the cloud gets everything, okay? Traditional studies have shown that this is much more accurate and better as a medical device than the traditional Holter, okay? These guys have raised more than, as of today, I believe, more than $75 million, okay? So that's number one. This is an example of what comes out from Stanford. Second one, Stanford in India. There is another program in India, you know, different situation, different worlds. You know, the team in India, they realized that, you know, the roads in India are terrible, okay? You know, lots of accidents, and this is the way they move patients, okay? Very, very, as you can say, very hard work, okay? And the problem is they don't have enough money to buy these things because they are expensive and they are not reusable, okay? So these guys, you know, they realize this is the team, they realize they can create a splint which is disposable and very cheap, okay? And this is a $5 disposable splint which has been already in the market, okay? So as you can see, 2 different things. Now let me put you an example of the 2 companies that we have created in the first year, okay? One is this is Usmima and this is Cocoon. Usmima was doing the clinical immersion at Institut Guttmann, and Cocoon was doing the clinical immersion at my hospital. And I'm going to explain a little bit about this one, okay? It's very easy. This is about, they are working on chronic constipation, very big issue for patients with spinal cord injury. And these guys are working on something for premature babies, you know, some let's say, some wearable that can protect kids with the noises, okay? Usmima, they are the past winners of last year Bioemprendedor, the other program, okay? They have a wearable that is non-invasive, non-chemical, non-pharmacological, and no side effects, okay? All the solutions that are on that field are either pharmacological or invasive, okay? And they have created and will be commercializing in the next 6 months a wearable that makes massages, abdominal massages, the same way that you do with kids. So, you know, you help patients with chronic constipation, you know. This is a big market with no solution like that, okay? And these are the outcomes at the European level. There are 4 programs in Europe which are supported by Stanford. And as you can see, you know, these are the number of editions that we have. These are the number of fellows that we have trained. And this is the people that are involved here in Catalonia. We have DHealth Barcelona. In Sweden, at Karolinska, we have KTMH. In Ireland, we have BioInnovate. And in Denmark, we have in UX. Okay, so we believe that this is the way forward for trying to engage people from outside healthcare, number one, and then to create ecosystemic programs that benefit all the agents in the sector. Okay, so nothing else. How many minutes? 2, 3? 2. Okay, ahead of time. So hope that you like it, and it's not a difficult program to put into place, but what it really is a program that has lots of benefits for the agents. Okay, thank you very much for your time.
Thank you, George. Thank you, George. You know, on your board, when you list the place where this program is, I want to add Strasbourg. We have a project here with the IHU, you know it. And my first question is, how hard is to build this type of program? What the barriers you met when you build this? What the barriers? The barriers.
Well, the main barriers are the organizations. You know, it is difficult to convince hospitals that you are going to put 4 people into the operating room, into the outpatients, into the emergency room. Okay, so the hospitals need to see the value of it. Okay, the first year, you know, they did it because they trust us a lot. This year, they really like the program. They understand that the potential benefits they get. It is tremendous. Number one, because hospitals can only create companies to a limit because they don't have so many clinical innovators people inside. The doctors are not entrepreneurs. They want to be entrepreneurs, but they want to be physicians. Okay, sorry. So that's number one. And then number two, it gives them, you know, a lot of ideas on how to improve their operations. So they love the programs. But the first barrier, usually it is hospitals and physicians. So you have to do a lot of explanation inside the hospital on what are these guys doing, because keep in mind, these guys, they get inside, they apply design thinking methodologies. Basically, they don't listen to their ideas, they observe them as they work. Okay, so they are almost, for 8 weeks, they're taking notes, watching everything, asking silly questions, you know. To me, for example, the most interesting example is one that they explained me at Stanford, right? So there is this physician, you know, which is one of the fellows getting into the operating room with the engineer, right? And the physician has been there in the operating room many times because he's a physician, he's a surgeon, okay? He has performed thousands of surgeries, okay? But the engineer, you know, he is the first time there, okay? So they get together and they're in the operating room, and then the engineer starts asking questions to the physician, right? So why are 7 people here if there is only 1 patient? Why are located like that? What is this machine? What is that machine? And he goes, what are you doing to the patient? Why are you taping the patient? Why are you taping the arm of the patient, right? And he goes, well, because we are going to put anesthesia on him, and he's going to be like that for 3 hours. So we need to make sure that the arms don't fall down. Okay, and the engineer goes, and in the 21st century, you haven't invented a better way to do it than with a duct tape, you know, which is very artisanal, right? And then the surgeon was like, fuck, you know. I've never thought about that. Okay, so only when you see things through different eyes, you're able to innovate and start new companies.
Thank you, George. You have a question, Alison?
A quick one, yes, a quick one, because as you know, with the hackathon coming up over the weekend,
excellent.
There's going to be lots of energy there, lots of ideas. What would be one message you would like to transfer to any young, dynamic, brilliant, future Steve Jobs or whatever?
Only one. Start with the real problem. That's the real thing. Because if you start with an idea or you start with a technology, something that already works, but there is no problem behind it, no clinical problem behind it, then you're gonna have very easy way through the development phase, but very hard way into the market phase. Okay. And I remember once at my hospital we did something like that, and I got 100 developers in the room, and they were asking me questions like, how can I put this and how can I put it in the hospital? And I was like, this is not our need, you know, we don't need this. You have developed that, but we don't really need it. Okay, so my suggestion, my advice would be start with a real clinical need.
Right,
okay?
Right. So not that I like it, but we need it.
Correct.
Yeah. And we definitely need
definitely
so
what
much.
we want to do in Hacking Health and continue to do that. Really, thank you, George, to be with us
Thank
today.
You. Thank you.
Thank you.
Thank you.